describe what you see in this video?
Yes, I can see the video of a child who is most likely infant, 2 to 3 months old, and he is having multiple hemangiomas all over the body. So he looks well alert and well grown for age, and there are hemangiomas on the chest, on the forehead, on the head as well, and on the back as well. So the back and the head hemangioma, they are more likely bigger in size, whereas on the chest and on the forehead, they are more likely 1 to 2 centimeter in size. So most likely my diagnosis is this is infantile hemangioma case.
Any DD you want to keep?
Yes, in DD, uh,
Okay. So this is an infant or toddler we are seeing. They have it is infant. That is, we are seeing there is multiple hemangioma distribution different parts of the body, head, over the forehead, and the back, multiple number. And at the end there is a temperature spike chart present, high temperature spike. So it is a case of infantile hemangioma or strawberry nevus. The DD we can keep like Sturge-Weber syndrome. Faces
yeah,
is
yeah.
posterior fossa malformations. Okay, Klippel Trinani Weber syndrome, Kasabek Merit syndrome, capillary hemangioma, cavernous hemangioma, birthmarks. So, Starch Weber syndrome very easy. Remember, Kasabek Merit syndrome also part one, part two. We study that. Faces Klippel Trinani Weber syndrome, capillary hemangioma, cavernous hemangioma, and birthmarks. What history you would like to ask?
Yeah, I would like to ask about the onset, course, and duration of the this illness. When did the rashes, these hemangiomas appear? Is it from the birth? And I would also like to take complete birth history and the neonatal history of the child. Um, yeah.
So onset course and duration, what increase or what decrease? Is it started at birth, increase in size, then evolution, color, any lesions, any other areas, stridor? Is there stridor? Sometimes respiratory tract, it even internal organ. Is there is hemangioma in the back or genitalia? Fever, weight loss, activity, sleep. Is affecting eye, any bleeding, pallor, palpitation, collapse, perinatal history of ventilations, any gestational age. Okay. And gestational age. What examination you do?
Yeah, I would like to check the whole general condition of the child in and check the vitals, especially blood pressure and signs of shock if it's present, and examination of the rash. And yeah, doctor. And
So
also, I would
airway
like to
breathing
go for
circulation.
examination of abdomen.
Hmm. Airway breathing circulations, hydration status, examination of the lesion and measure it, skin around, any crusting, oozing border of the lesion. So the rest lesion, we know that rest examinations, any crusting, oozing, all system we can examine here because it can occur in any part of the body. Cardiac examination, chest examination, neurological examination, abdominal for any bruit and eye examinations. What investigation we do?
Investigation complete. I would like to take complete history and examination of the child and ultrasound of the this Doppler ultrasound of this and MRI of the child and skin biopsy.
So investigation we are doing diagnosis by history examination and does not require any lab test. We might need to do the ultrasound and or MRI scans on a child who has a hemangioma that is deep near their eye or affecting the internal organ. So MRI you can do MRI scan. We infect a full blood count ESR blood culture imaging MRI abdomen echo you can do brain MRI for faces. Skin biopsy we are doing, search for other hemangioma, intraocular pressure measurement. Hemangiomas over the midline of the lower back may require screening for underlying abnormalities on the spinal cord, internal organ, and genitalia. What is the management we are giving?
Yeah, we will involve the multidisciplinary team, including the dermatology and hematologist and cardiac and plastic surgeon as well, cardiology and plastic surgeon as well, and also the medical treatment. I would like to give this topical timolol gel and beta blockers, oral propranolol if it's involving the eye as well, and also I would like to start the steroids and interferon alpha if it's life threatening lesion, and surgical
Okay.
excision by laser.
Okay. So management actually I'm telling most hemangioma do not require treatment except in the following situations. So most not require treatment like It is particularly large, affect the areas where resolution may be incomplete, like lip, nose, ear, hair. It is ulcerating, it is interfering important function like hearing, visions. Then medical treatment, we are giving topical beta blocker, timolol gel, and systemic beta blocker after resolution of the cardiologist. Oral propranolol we can give, steroid we can give, interferon alpha, life-threatening lesions, surgical excision, and laser therapy. So most are resolution occur if interfering our activity, it is not resoluting, ulcerating very big area, then we are giving treatment. Medical treatment we give surgical, laser therapy. Medical treatment we are giving like beta blocker, prednisone, steroid, these are. And medicine team involved are dermatologist, hematology, cardiology, and plastic surgery. Yes, dermatology because skin lesions here, hematology, it is a capillary hemangioma, cardiology, plastic surgery. What is the indication of treatment and complication?
Yes, indications of treatment are age of the child, if the hemangioma is very large and having ulceration as well, and it affects the area where resolution may be incomplete, like nose, lips, ears, and eyes, and interfering with important functions, including feeding.
Yes. So indication of treatment to the age of the child not resolved by age, hemangioma, large ulcerations, affects areas where resolution may be incomplete, nose, lips, eyes, ears, interfering with important functions, feeding, breathing, hearing, visions. Complications are ulceration, bleeding, scarring, pain, infections. How common are hemangioma? So hemangiomas are not inherited, but families often say relative had a hemangioma in childhood because they are very common. More common in girls, premature baby, low birth weight, multiple birth. Okay. Advice we are giving, what advice? Thin film of Vaseline. Vaseline can be used to keep them dry, not moist. Avoid sun, avoid bubble bath, short nails, gentle pressure if mild bleeding or oozing. So Vaseline used for avoid sun, avoid bubble bath, short nail, gentle pressure to mild bleeding or oozing. So this is all about this video stations. Thanks.
Okay.